I'd like to call the House Population Health Subcommittee to order. Would the clerk please call the roll? Open the board. Thank you, clerk. Would you read out the roll for us, please?
Madam Chair, you have 9 members present. You have a quorum.
Thank you. Well, welcome to Population Health Committee. It is March 10th, 2026, and we've got a heavy agenda today, so I would ask that everyone would be respectful of everybody's time. And if you've got signs, please lower them to where you're not hiding the person behind you. I would appreciate it. And also just wanted to say, we've got a lot to do, so we're not going to waste a lot of time. So I would ask that you be very respectful and keep the yelling and all down. So, okay, well, let's go ahead and we are going to move SJR 0565, which is number 7 by Representative Alexander, without objection. Okay. Got a motion and a second. So you're probably before us. Thank you.
Thank you, Chairman. And this is the first time I've ever had an opportunity to come before you, and you and I started here together. So very special day for me.
And you're special
in
to
your
me.
committee.
Thank you.
This bill does is it recognizes March 2026 as Endometriosis Awareness Month. Endometriosis affects 1 in 10 women of childbearing age in the United States, and whereas endometriosis is a chronic gynecological disease of the female reproductive system and is the leading cause of pelvic pain and infertility. And while endometriosis is known to cause pelvic pain and infertility, some women have had other symptoms depending on the location of the endometriosis, and some women have no symptoms at all. And there is an average delay of 10 years from the onset of the symptoms to the final diagnosis of endometriosis. Endometriosis in its treatment results in tens of thousands of hospitalizations, lost productivity, and absenteeism at work due to chronic pain. And there is no cure for endometriosis, and more research is necessary to develop additional treatment options to manage this potentially debilitating disease. And evidence-based standards are based on the severity of the disease, and the treatment may include oral contraception, progestins, non-steroidal anti-inflammatory drugs, and surgery. And although access to surgical treatment may vary by region, insurance coverage, and availability of clinicians. Education about endometriosis and its symptoms is important to promoting awareness among the public and healthcare providers alike, and enhancing the early detection and diagnosis of the disease.
Thank you, sponsor. Are there any questions for our sponsor? Okay. Seeing none. So, clerk, would you please open the board to vote? Okay, clerk, would you close the board and announce the vote, please?
Madam Chair, you have 10 ayes, 0 nays.
Thank you, clerk. And thank you, sponsor. You are moving on to full health.
Thank you, Chairman.
Okay, now we're going to go back to our regular agenda, which is number 1 with Representative Shaw. Did he come in? He didn't come back in. Which is bill number 1534. And I think I heard a motion and a second. And do you have any amendments?
I do, Madam Chair.
Okay, would you care to give us that drafting code?
Drafting code is 014025,
Okay.
and it makes the bill.
Okay, I need a motion and second. Second. Okay. We have that amendment on there, and your bill is properly before us. I thought we did. Did we not? Okay, so all in favor of adding the amendment, say aye. Are those opposed? Okay, all right, so we've got amendment number 014025 on your bill, so you may present, and we're glad to see you.
Good to be here.
Yes,
Thank you. What this bill does, this bill, subject to appropriation, of course, this bill would allow the Department of Health to create a program, a grant program that is for women whose pregnancy ends in stillborns. It's not forcing anything on the health department. It's just saying that if the health department would like to and have the funds, they could create a grant for stillborns, that's pregnancies that ends in stillborns. And with that in mind, I would take any questions from committee.
do we have any questions for our sponsor? Okay, seeing none, I guess we're all ready to vote, so clerk, would you please open the board for the vote? Seeing that everyone's voted, does anyone want to change their vote? Okay, clerk, would you please announce the vote?
Madam Chair, you have 10 ayes, 0 nays.
Okay, so we have House Bill 1534, moving on to full health.
Thank you,
We
Madam
hope
Chair.
you feel better too.
Thank you.
Okay, so coming up next is item 2, which is House Bill 0570. Do I have a motion? Well, I need a motion on the bill before we can add an amendment. So, well, bill fails for lack of motion. Okay, moving on to number 3. We have House Bill 1943 by Representative Love. Is he in here? Is he in here? So, okay, we'll just roll it. We'll roll it. Okay, we're going to roll that. Where? Oh, okay. Okay. Do we need to clear the committee, which therefore no one is allowed in? Clear the committee, please. Do we need to get? That's what I said. Clear the committee. Let's go.
Just go ahead and go to the next bill.
Well, this guy, it's over this guy. Okay. Representative Love, would you come present your bill? 1943. We have a motion and a second, and I believe you have an amendment. Do you want to give us that drafting code?
Yes. I want to make sure I get the right one. I believe last time we added, and I apologize, I want to make sure I got the right one.
We're waiting on you to give us the number.
14666.
That's correct.
Okay.
Okay, do we have a motion and a second to add the amendment? Okay, all in favor, say aye. Aye. All opposed? Okay, your amendment 014666 has been added, so you're ready to present your bill.
And I also had another amendment and I apologize, because there was another amendment that wanted to clarify.
What is it? We added 2 last week, and now you've added another one this week. So have you got 4 amendments?
No, there was a request that we add one that specifies, okay, you know what? Yes, it's the right one. Thank you.
Okay, so we put 3 total, is that correct?
Yes, and I think this last one rewrites everything.
Okay, 014666
Yes.
rewrites the whole bill, correct?
Yes, ma'am.
Okay,
Sorry about that.
so I think we're all properly
Yes.
and gavelled and motioned and all. We're ready to go, so let's
Yes.
hear from it. The show is on. We did.
All right, thank you so very much. Again, members, I discussed this bill last week. This particular piece of legislation with the clarifying amendment specifies that this does not have a requirement that this deals with abortion care, but it simply says that women who present themselves at the emergency room who are pregnant will receive care from the hospital emergency room. And with that, I've completed my presentation.
Okay, you've heard from the sponsor. Do we have any questions for our sponsor? Yeah, Chairman Kumar.
Thank you, Representative Love, for bringing this. My concern is that how does this connect to the federal law that is EMTALA?
Correct.
That is Emergency Medical Treatment and Active Labor Act.
Yes, sir.
So all what I read in this is covered under EMTALA already, and that's been a law for more than 20 years. And so if that is so, you can justify how it differs from EMTALA. And if it does not, then why do we need this legislation?
Thank you so very much. Thank you, Madam Chair. Thank you for the question. If I'm correct about this, in current state law, we do not have this in code. And so we are codifying what this talks about. And that's one of the reasons we want to bring this in. It also allows us that if federal law ever is removed for EMTALA, we still would have a state law that says these things are required.
Chairman Kumar.
Does it add anything more than EMTALA does?
I don't believe it does. Now, I would have asked a question with regard to EMTALA. Does EMTALA just refer to hospitals receiving Medicare or Medicaid payments, or is it for all hospitals? Is it?
Pretty well all hospitals do receive Medicare or Medicaid payments. They can't
Right.
function without it. So it's a moot point, but my thinking is it applies to all healthcare facilities.
Right.
And other concern is, my question was, does it add anything more than EMTALA does?
Thank you. I don't believe that it does, but what it does do, it makes sure that in our state law, in our Tennessee code, we do have this identified. And again, if there's ever any instance where federal law would be changed, we would have this in place to say that in Tennessee, we still have a law that says that emergency rooms must provide treatment for or screening for, or then provide assistance for women who are pregnant and are in labor to go to a hospital that can receive them.
Thank you. Madam Chair, can we have a question? I have a question for legal.
Yes, so we'll go out of session to hear from legal.
Could you clarify or confirm that this does not add anything beyond EMTALA, which is the federal law? And does it have any connection to abortion care?
Heather Oswald, Legal Services. So this proposed bill, Representative Love, is very similar to the current EMTALA and federal code. Some differences between the two include that House Bill 1943 explicitly applies this language to satellite emergency departments, but EMTALA does not. It does specify it as applied to dedicated emergency departments operated by a hospital, which may be similar. House Bill 1943 adds licensure sanctions. House Bill 1943 has a good faith exception, but EMTALA does not. This bill also has a knowingly and willfully violates this section provision, but EMTALA is negligently violates this section. And this bill defines capacity, but EMTALA does not. So there's some differences between current federal law and this bill. And then your second question, Representative Kumar, was whether or not
Does it relate in any way to abortion care?
this legislation in the newest amendment specifically says that this section does not authorize an abortion unless the conditions in our current code for abortion are met, because there are two instances where a woman is permitted to get an abortion. And so this section does not allow you to get an abortion other than what is currently allowed via our law.
Thank you for the clarification. Thank you, Madam Chair.
Okay. Chairman Terry.
I guess for clarification on that, I guess the question you brought up about the satellite. So one of the issues, well, it's a different standard, correct? You have the negligence or gross negligence, and the other is
The bill, the amendment, and the newest one, 14666, it also has who knowingly and willfully violates this section. EMTALA has a negligently mens rea in there.
okay. I'll ask when we go back in session.
Does anyone else have any questions for legal? Do you have a question for legal?
Madam Chair, I think the statement was made about civil or licensure penalties in this piece of legislation. And I thought that we said in the amendment that a civil penalty or licensure sanction would not be imposed.
It said under this section for conduct that is subject of an enforcement action, settlement, corrective action, or plan or final determination under EMTALA. And so let me look at the original bill.
And I think at the top, it also says a physician, qualified medical professional, hospital is not subject to civil penalty, licensure sanction, or the adverse action of the section if the physician, qualified medical professional, or hospital employee acts in good faith and exercises reasonable clinical judgment based upon the information available at the time care is rendered or a transfer decision is made. I just want to make sure everybody, I think that's.
Yes, sir. I was just saying the differences between your bill and EMTALA. EMTALA doesn't reference any kind of license or sanctions versus your bill does make some references to that. And so I was just mentioning that as differences between the two.
Thank you. And I just want to make sure that members didn't hear that there was a civil or licensure proposal in the bill, if everybody understands what I'm saying.
Yeah.
Any more questions for legal while we're out of session? Okay. We'll go back into session. And does anyone have any questions for our sponsor? Chairman Terry?
Yeah, thank you. Again, thank you for bringing this. And if this bill goes through, I guess the concern that I have, obviously dealing with, being a physician and dealing with physicians that deal with EMTALA every single day, they're trying to comply, and they get phone calls from all over, and they have to accept patients from all over, wherever they may come from, and the concern that I have with putting state process in there in addition to the federal process is confusion. They may say, well, we're complying with state law. It has a different standard than the federal law. Now we have emergency satellites that aren't otherwise covered. So if this bill happens to go forward, I would just be more comfortable having, and I'm actually doing this, presenting a bill later on today that's going to do something like this. In the event that something changes at the federal level, this kicks in, a trigger type of event, so that we're not confusing our doctors, not adding more to our doctors. I would be more comfortable with that, because we certainly want to take care of the patients when they're coming in, but it's the confusion, and I don't want someone to, think that they're, doing the state standard, but all of a sudden they've messed up the federal standard. And that's my concern.
And I might just add, since my husband and daughter UT Medical Center and the ER and all, they don't turn down anyone. Don't know any of them. I mean, doctors take an oath that they will administer help whenever, wherever they're at. And so I feel like this is just something that Intala already takes care of. And it's just like Chairman Terry said and Chairman Kumar, this is just more confusion that we just want to pile on doctors. And, you know, in emergency situations and all that, they're already stressed. As a matter of fact, I mean, if somebody comes in, they're coming in basically from first responders and all. And first responders are bringing them in. And so hopefully, I just don't see the need in it. I feel like it's already covered. And I just don't think we need to keep adding more stuff to confuse everybody to where something may fall through the cracks. But I can tell you right now, they're not turning anyone down because my husband and daughter were on the front lines of COVID. And no one got turned. They didn't turn anybody down, and they put themselves at risk, and their whole families. So I can write a book on that. They put themselves at risk over patients and all. So I just don't think I can vote for it because I feel like it's just a duplicate of what is already happening. But thank you.
If I can say, Madam Chair, I think that in my time here, I've witnessed many instances where departments are doing something. They're doing it well. And without question, they're dedicated to the citizens of the state of Tennessee, and they do it well. And then a member brings a piece of legislation that spells out exactly what the department is doing. And I've sat on a committee and asked the member, why are we bringing this? And many times the member said, I just want to put in code, not to add confusion, but just to lock in what they're currently doing well so that everyone knows that this is what they're doing well and they'll continue to do it, not to provide confusion and not to dump on anybody, but just simply say, if you're doing it, keep doing it. And now people know that you're doing it because we oftentimes have to think about what happens when we are no longer in these seats. What happens when you may have a professional who is not aware of what has been done and puts in code and says, this is what our Tennessee law says you should do. You've been doing it. And that's why we said it's not anything in addition to MTAL, except for those instances where it's talking about those satellite emergency rooms. And those instances kick in right there. And we spelled out again specifically that this does not have anything to do with abortion care. That's what the amendment says. I think that's one of the benefits of codifying law at the state level. If it's federal law, we're codifying it. If it's departmental process and regulation they're implementing, we codify it as well.
Anybody have any questions for a sponsor? Are we ready to vote? Okay, clerk, would you please open the board? Has everybody voted? Anyone want to change their vote? Okay. Clerk, would you please read the vote?
Madam Chair, you have 6 ayes, 4 nays.
Okay, so Representative, your bill will be moving on to full health.
Yes.
Oh, and legal, would you care to roll all the amendments into one? Okay, we got that. Thank you. Okay, next up is Chairman Kumar, 2569. So your bill, let's see, nope, you do not have any amendments, I don't see, correct?
Right.
Okay, so your bill is properly before us, so you may proceed.
Thank you, Madam Chair. House Bill 2569 is an extension of the current law which requires hospitals to offer flu and pneumonia vaccines to patients 65 and older at the time of discharge. 2569 will change that scenario so that the hospital will offer flu and pneumonia vaccines to patients at the time of discharge age 50 instead of 65 and over. This would include flu shots during flu season, pneumonia shots around the year. The reason this change is important is that viruses are changing, patients are more at risk with more illnesses, and high risk starts at age 50. The vaccines, again, are offered, they're not required, and patients may accept or decline. With that, I renew my motion.
Okay, we do have someone that has signed up to speak on this, but we're not going to, so
It's Bernadette.
yeah, that's what I thought. So, okay, so does anyone have any questions? Okay, we have a question on the bill. So all in favor, ready to vote? You open the board, please. And clerk, would you read the vote?
Madam Chair, you have 10 ayes, 0 nays.
Okay, Chairman Kumar, your bill is moving on to full health.
Thank you, Madam Chairman and committee.
Okay, the next item 5, that was by Representative Travis, House Bill 2176 is off notice. And so then we are going to move up to Chairman Terry, House Bill 2380, because he's got there's another bill being ran today that kind of, so do you want, go ahead? Okay, all right. Okay, well, he said we'll go ahead here and skip over to item number 6, which is Bill 1852 by Representative Fritz. And you do have an amendment. You want to give us your drafting number? Or do I got a motion and second on the bill? Do I have a motion and second? No? Okay, well, bill fails due to no motion.
Thank you, Chair Lady.
Thank you. Okay, well, okay, Hawk didn't come back. Okay, so we're going back to Chairman Terry. House Bill 2380. Second. Okay, we have a motion and a second. And you have an amendment. You want to give us that number?
015112.
Okay. All in motion for 015112 being added?
Second.
Okay, have a motion, have a second. Okay, and all in favor of adding it, say aye.
Aye.
All opposed? Okay, so we have your amendment 015112 added to your bill 2380. You're ready to proceed.
Thank you. House Bill 2380 clarifies the enforcement mechanisms for Tennessee's existing protections regarding abortion-inducing drugs. Current law already restricts the unlawful provision of these medications. This bill does not change that. However, enforcement tools are not clearly defined and lack meaningful civil penalties. Current law states the Attorney General and reporter may bring an action to enforce compliance with this part or intervene as a matter of right in a case in which the constitutionality of this part is challenged. This bill simply provides the Attorney General with a clear mechanism to enforce those existing protections and establish proportional and civil penalties when the law is violated. The legislation creates a $10,000 civil penalty per violation, and when the violation results in serious bodily injury or death, it allows for $1 million penalty. Each instance in which the abortion-inducing drug is unlawfully provided counts as a separate violation. The intent is straightforward.
Okay, members, you've heard the explanation. Does anyone have any questions for our sponsor? Okay, seeing none, are we ready to vote? Clerk, would you please open the board? well.
Is it not open on y'all screens?
Mm-mm.
Okay, I can do, let's do a voice vote. Is that okay? Is it?
That's fine with me. Yeah. All in favor, say aye.
Roll call vote, excuse me.
Oh, roll call. Oh, okay, okay.
I apologize.
Okay, so let me just see. You're gonna,
Yes,
everybody
ma'am.
ready? Okay, okay.
Representative Brooks? No. Representative Brooks? No. Representative Clemens? No. Representative Clemens? No. Representative Gillespie? Aye. Representative Gillespie? Aye. Representative Helton Haynes? Aye. Representative Helton Haynes? Aye. Representative Kumar? Aye. Representative Kumar? Aye. Representative Rudder? Aye. Representative Rudder? Aye. Representative Sherrill? Aye. Representative Sherrill? Aye. Representative Terry? Aye. Representative Terry? Aye. Representative Travis? Aye. Representative Travis? Aye. Chair Lady Carringer? Chair Lady Carringer? Aye. Madam Chair, you have 8 ayes, 2 noes.
Okay, Chairman Terry, your bill is moving on to full health. Okay, let's see. Chairman Hawk did not come in, so, oh, Chairman Hawk. Okay, because you're still in your other bill, so we'll go ahead and get you really quick, committee, so you can get back. Okay, Chairman Hawk is House Bill 2313, and you do have a motion and a second, and I do not see any amendments. So your bill is properly before us, so you can proceed.
Thank you, Chair, lady, members, and thank you for your indulgence chairing a committee across feels like the street, but just across the hallway there. This bill will authorize the Department of Health to establish a voluntary, very important to say voluntary, permissive, evidence-based home visiting program focused on early childhood mental health. We've worked in this space. We've had really, really good programs working both in Northeast Tennessee and West Tennessee that have allowed families to really deal with any potential issues that have come up through some of the family nurse in-home nursing programs that have gone on. This is going to help us work in that space. Those original programs were brought by John DeBerry and former Senator Diane Black when she served in the state Senate here. So we're just trying to replicate that. Emotional, social, behavioral issues with our young children are beginning at even an earlier age. And this is going to help us work within that space, Chair, Lady, and members.
Okay, members, you've heard the explanation of House Bill 2313. Does anyone have any questions for a sponsor? You seeing none? Everyone ready to vote? It looks like it is still out, so. Okay. No. We'll just do another roll call. I don't know. Would it work if we logged out and logged back in?
We can try that. Would you like to try that? It's up to you, Madam Chair. Let's try it.
Okay, that's fine.
So I'm going to adjourn the meeting and restart it. That's the only, I logged out on mine. We can just do a roll call. Unless you did, everyone individually logged out.
Yeah, we'll just do roll call if everybody's okay with that. Okay, roll call then.
You're on.
Representative Brooks? Yes. Representative Brooks? Yes. Representative Clemens? Yes. Representative Clemens? Aye. Representative Gillespie? Aye. Representative Gillespie? No. Representative Helton Haynes? Aye, excuse me. Thank you. Representative Helton Haynes? Representative Helton Haynes? Aye.
Representative Kumar. Representative Kumar, aye. Representative Rutter. Representative Rutter, aye. Representative Sherrill. Representative Sherrill, aye. Representative Terry. Representative Terry, aye. Representative Travis.
Aye.
Representative Travis, aye. Madam Chair Carringer.
Aye.
Madam Chair Carringer, aye. Madam Chair, you have 10 ayes, 0 noes.
Okay, Chairman Hawk, your House Bill 2313 is moving on to full health.
Thank you.
Thank you. Oh, okay, yeah, that's what I've got. Is that what you got? Okay. Let's see, there we are. Forget, oh, there we go. Okay, moving on to our last bill for the day is House Bill 2523. Okay, you have a motion and a second, and I don't see any amendments on there, correct? Okay, you're ready to explain your bill.
Okay, thank you, Chair Lady. My annual visit to this committee, so thank you for having me again. This is a simple cleanup bill to the Medical Ethics Defense Act, which was passed last year. That law created broad conscious protections for providers and institutions, but it also left uncertainty about access to necessary pregnancy-related health care. This bill clarifies that those protections cannot be used to deny standard, medically necessary care to pregnant patients when that care is within a provider's license and professional obligations. It simply ensures that patients can still receive emergency care, treatment for pregnancy complications, and routine prenatal and postpartum care. This legislation does not expand the scope. It does not create new procedures. It just clarifies the law so that patients and providers are not left in the dangerous gray areas. I respectfully ask for your support, and I know that there are individuals who would like to testify as well.
Okay, y'all have heard an explanation by Representative Bain, and she does have. Okay, and she does have 2 individuals, but I thought she got a motion second. Okay, I thought they said she got a motion second. Okay. So. Well, since the room was cleared, even though she got a motion and second, then they can't come in and speak. So any questions though from to our sponsors from our members? So Chairman Clemens?
Yeah, thank you, Madam Chair. I've served in this body for 12 years now, and we've cleared many rooms up here, unfortunately. And every time we have invited the witnesses into the room by name, and those gentlemen standing out there have assisted with that in a very easy and straightforward manner with no complications. So I don't know why we're not allowing witnesses who've taken time out of their busy schedules to be up here to testify. But if that's your ruling, then it is what it is. But Ms. Representative Bain, can you enlighten us as to what type of testimony would have been shared with us today?
Yes, I'm waiting on the testimony, but this bill, the genesis of this bill, there was a woman in Jonesboro who had been unmarried, but with her partner for, I believe, almost 13 years, had 1 child with that partner and was pregnant, and solicited care from a physician who denied her care because she was unmarried. And she relayed this at a town hall, and I think it laid bare the necessity for this bill in particular to clarify the institutional policies for healthcare providers across the state of Tennessee.
That's all I have. Thank you, Madam Chair.
Any questions? Chairman Kumar?
What was the care that the woman needed? Do you know what care she needed? Was it related to, can you tell me what was the care that she needed?
I believe it was a prenatal visit, and so it wasn't specialized care. It was a prenatal visit.
Thank you.
Chairman Terry.
You and thank you for coming before us. And that was something that obviously, when it got brought up, we looked into. And the way that the Medical Ethics Defense Act is, it's procedures, treatments, or service. It doesn't say to somebody. So by her saying she's unwed, that's not covered as a conscious protection from Medical Ethics Defense Act. It's the procedures. So unless that provider just doesn't do prenatal care, then and that would be their, if maybe they're just doing GYN, I don't know. But that was something that it did not apply from the Medical Ethics Defense Act. And then with that, whatever instance that had occurred, we looked into it, and we'd been told that that person had filed complaints. We went through with a couple of departments here. We found no complaints. We couldn't find that had occurred. Not saying that it didn't occur, but we could not find the complaint where she said that she had complained to, I think, DCI and maybe Board of Medical Examiners. So anyway, that was my concern, that I think it's what the instance you brought up wouldn't have been covered by the Medical Ethics Defense Act.
Thank you, Mr. Chairman. I imagine it was a really traumatic experience for her, being a young woman in the state and going to a physician that I think would be obliged by not only the Hippocratic Oath, but by the professional standards and responsibilities of a provider to provide that care, and then be denied, I imagine would be really traumatic. I do have the incident that she wrote, so I just want to relay this in case it clears up any vagueness. The baby was due on March 5th, 2026, 5 days ago. Let's see here. So my name is Michaela Webb, and I'm here to share the testimony from a woman who is denied prenatal care. She is a Tennessee mother, and in June 2025, she found out she was pregnant after trying for a decade. At her first prenatal appointment in Tennessee, she was told the provider would not treat her because she was unmarried. They said it violated their morals explicitly to her. She was not asking for approval, but she was asking for prenatal care. After that appointment, she had to go to Virginia to find a provider who would see her. She had to cross state lines to receive this basic prenatal care. The Maternal Healthcare Protection Act, which is what we are voting on today, would ensure that no pregnant Tennessean can be turned away from care because of someone else's personal beliefs. No Tennessean should need public attention to receive treatment. Thank you.
Are there any other questions from the sponsor? Everybody ready to vote? Okay, are we going to try the board or? It broke it. Okay. It's still on House Bill 1852.
Representative Brooks? Yes. Representative Brooks votes aye. Representative Clemens?
Yes.
Representative Clemens votes aye. Representative Gillespie?
No.
Representative Gillespie votes no. Representative Helton Haynes? No. Representative Helton Haynes votes no. Representative Kumar?
No.
Representative Kumar votes no. Representative Rutter? No. Representative Rutter votes no. Representative Sherrill?
No.
Representative Sherrill votes no. Representative Terry? No. Representative Terry votes no. Representative Travis?
No.
Representative Travis votes no. Madam Chair Carringer? No. Madam Chair Carringer votes no. Madam Chair, you have 2 ayes, 8 noes.
Thank you, clerk. So your bill fails, but thank you for bringing your bill. Okay, our committee is closed to the call of the chairman, but I would like to thank our legal department, who has done an outstanding job, and also our clerks. And then I want to also say thank you to Bart Kenner, who was our new research guy and who's done fabulous. And then to always my lovely assistant over here, Zach Huff. And does anyone else have any more announcements? Chairman Terry.
Just want to thank you and thank the committee for all the work that we put in, but thank you for your leadership and appreciate what you do.
And thank you to all of y'all, because it takes all of us. So thank you to everyone, and hope everyone has a great rest of the day and week and session. And you cheer your boys on for baseball, Chair Clemens. Did y'all win?